Come on, stop it. Extreme decorating disasters, how not to use tongs this holiday, and a snowman with a severe axe to grind. Today, we're reacting to some of the most medically insane winter emergencies from Jack Frost, the horror film. Let's dive right in. Foot on the neck, decreased blood flow, you're compressing the blood vessels, the carotid artery, jugular vein, but you have flow on the other side, so you still should be okay. But you can be compressing the airway, you can be breaking the cartilage of the airway, you can squish it enough where it actually occludes the airway as well. Rapid torque of the neck and the head to cause injury to the high up cervical spine. Could that injure the high up in the neck, the brain stem? To where it's not compatible with life? Yes, there's always the potential, but it doesn't look like it from this motion. Oh. What type of fluid is this? Ooh. We're getting some sort of chemical sprayed all over the body, causing chemical burns, enough to melt skin away. So you're thinking of something that's either acidic or basic. Once the fluid's pH either goes really high, so very basic, or really low, really acidic, it starts causing damage on both directions. The pain of it is significant because you're burning off nerve endings and the skin is fluffing off. Sometimes we see skin fluffing off with actual different types of reactions as well. Something called Nikolsky sign, when you actually push on the skin itself and it actually just sloughs off. Oh! Come on, stop it. Come on. You'd have to have enough weight, speed, and sharp enough for this to occur. Would death occur instantaneously? Yes. Can't live without your head. You'd have a significant amount of bleeding though. There would be more blood on the head component as well as the body component. What? Oh my gosh, come on. Come on. Penetrating trauma through the posterior pharynx to probably the base of the skull, out the upper part of the cervical spine, breaking through the airway, and then it's going through the vertebral bodies. Oh. Oh. String lights causing a strangulation injury. You're compressing not just the airway, but the blood vessels in the neck. Ornaments in the mouth. These ornaments these days break pretty easily, so that would not stay in the mouth like that. It's going to cause a lot of lacerations inside of the mouth. You'll still be able to breathe through the nose.
Your nose!
Ow. A bunch of lacerations from the glass to the face. I always tell people, hey, don't pull anything out. Well, some of these you could probably pull out. With these areas, you have the ability to do direct pressure to stop bleeding, so you can actually do that. That would be okay. Jack Frost is not nice. Oh my gosh. My question ends up being, for this scenario, how did she pass away? I'm assuming it might be the star into the brain, because the other injuries are still compatible with life, unless there was enough strangulation going on that would slowly decrease blood supply and oxygen to the brain and the rest of the organs. Whoa, darn. Injury to the left shoulder, this spot of your shoulder, right? So a lot of muscle there. You have attachments of your pec major and pec minor. It's also an area where a lot of blood vessels will run, as well as the nerves that come out of the axilla, aka the armpit. Stop it. Injury straight to the forehead, through the brain tissue. The likelihood of survival is pretty darn low, especially hitting both hemispheres of your brain. Lots of swelling, brain matter would be coming out, and big, massive fractures to the skull. Oh, what the? Look at that neck. Look at that neck. I've seen it in the emergency department. Somebody has bowel obstruction and they're actually vomiting feces, not solid poop like this. The neck is swelling. First thing I think of is allergic reaction, an expanding hematoma, which I've seen where somebody's bleeding in their neck and it's just expanding in front of my own eyes. Unlikely a tumor. Tumors grow a lot slower than that.
It's not a tumor.
What is coming out? Snow? Ice? What the heck is that?
What the hell
is even that?
I've never seen anybody vomit white before. I've seen people cough up foamy mucus, and I've seen people projectile vomit like this, but not white. If you're having projectile vomiting as an adult, it could be issue related to bowel obstruction. Oh no! Glass went perfectly through the mouth. The only way that this person would not be with us is if it went all the way through and it sliced the brain as well as the brainstem. Just get to the hospital, let us take this piece of glass out because you just don't know the effects on the airway, how much bleeding is going to happen. You know that I am so annoyed when everybody just comes up with blood out of their mouth. Directly through the epigastric area, probably. You're going through your stomach, you're going through the esophagus, the intestines, having bleeding into those structures. But does it automatically go retrograde and back up? No. Oh! It's an anvil, right? Crush injuries do occur. Most of the time, the crush injuries that we see in the emergency department are like TVs falling from like storage, or something falling off a shelf, causes either a laceration, a small head injury. You might have post-concussive syndrome, those sorts of things. Very rarely do we see an anvil falling on somebody. Oh, ouch. Sharp impaled object to the bottom of your foot, right where you have the attachment of your plantar fascia. I don't know if anybody out there has ever had plantar fasciitis, but you know the pain of that. Just think about it being impaled, rupturing right through. Massive impaled objects that you fall on. Instant death would be due to the fact that you rupture your aorta or the whole heart itself. But again, you should be alive for a couple minutes before you pass out and then die thereafter. Oh, straight through the eyes, into the skull itself. That deep, they're probably going into the frontal lobe or just to there because you have your eyes, you have the muscles of the eyes. So there is some distance that it does need to travel before it goes into your brain, but the frontal part of your brain does sit above the eyes. Whoa. Oh, wasn't expecting that. Oh, that is nasty and gross. Head explosion.
I can't believe your head exploded.
This doesn't come to the emergency department. Not compatible with life. Ridiculous. Normal amount of like blood. Actually looks fine. Dry blood on the hands. It wouldn't dry that fast. Carrot to the eye. The bones medially are actually pretty fragile and easily to break. There's even one that's called lamina papricia. It's literally paper thin. That can actually cause a bunch of bleeding as well. Oh my goodness. How would you fix this? Some liquid to that area to get your tongue off. Don't try to like moisten it with your lips because they may get stuck as well. Probably lukewarm water would be quite helpful. Cowatunga! Oh my gosh. Cowabunga! Could you actually rupture your tongue off? You probably actually rip more the tip of the tongue off versus the massive base of your tongue. The tongue is even thicker back there. It actually goes deeper. It's a huge, big muscle. Snowball, holy cow. If wintertime disasters like this has your stress levels rising faster than a blizzard warning, that's where Chillax by my company, Life Happens, could come into play. Designed to help you stay calm, even when life feels like a horror movie. Find Chillax at lifehappens.com or on Amazon. Oh my gosh, it's arterial bleed, attempting to show us arterial bleed that's pulsatile. This person is now exposed to any bloodborne pathogen that this individual might have. They didn't have enough time to put on their PPE, their personal protective equipment that we use at the hospital, usually face shield, mask, and gown and gloves. Oh my goodness. Icicle to the forehead. Again, not compatible with life. It's going straight through your brain. I just like how those individuals are just watching and not running out of that scenario. Oof, getting hit that hard in the epigastric heart area, could that kill you? I mean, in a rare instance, it could hit in a certain moment of the beat of your heart and cause it to go into an arrhythmia, or you get hit in the epigastric area a little bit lower and it can cause the bruising and significant bleeding to your first part of your intestines, to your duodenum. Oh, impaled right into the eye, so that eye is gone now. The globe has been ruptured. It's gone all the way back, further back into the eye socket, maybe into the brain. Oh! Smart person here taking a cast iron skillet to smack it even further into his face into his brain. Normally what you would end up seeing is a rush of fluid coming out of the eye, significant amount of bleeding, and significant amount of pain for this individual because you're hitting back into the nerve, into that posterior part of the eye. Oh my gosh, just biting off his fingers. Could you reattach the fingers? Maybe. If you have the fingers, grab them, put them on gauze or something, and then wrap them in a bag. Then in another bag, put icy water in there so they're not directly on the fingers themselves because you don't want to cause frost nip or frostbite. Oh, and the neck. Oh my gosh. Bite wounds from animals. We will cover you with antibiotics if you do come to the hospital because they're dirty wounds from a mouth. That much blood coming out, that's the aorta or the inferior vena cava or the superior vena cava, which is one of the major vessels that are ruptured open. Back of the brainstem. All the way through the mouth. You're not compatible with life if that was a direct shot through hitting the spinal cord in the back. Laceration to the neck itself. Depending on where the laceration to the neck, it might be a superficial vessels that have been hit versus the deep ones. The big ones that you worry about are the internal jugular vein and the carotid artery. Ooh. What? I have never seen this much fluid come out of an individual all at once. We do have people that have profuse diarrhea in the hospital that require rectal tubes because they're just pooping out so much, or somebody vomiting so much. Even when somebody unfortunately passes away, there's not this much fluid that comes out of their body. In my winter wonderland, I do not envision Jack Frost being this demonic or evil. I have a much happier view. If you guys enjoyed this and you want to tell me more about the backstory of this Jack Frost, please in the comments let me know. And if you enjoyed this, definitely check out this playlist right here, Binge Watch Everything. And do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.